A pleasant good afternoon, and we're here today doing a trauma nursing certification course for the nurses at Wong F. Louis Hospital and Snyder Regional Hospital. And this class is being brought to the nurses of the territory through the Emergency Medical Services for Children grant. And one of our performance measures that we have to meet for this grant is making sure that we educate the nurses in the emergency room, in the NICU, whether it be ACLS, PALS, or today we're doing trauma. And so because we don't have a trauma center and most of our pediatric critical patients have to be flown out, we want to make sure that we can strengthen our trauma care throughout the territory and especially in our first access entrance, which is the emergency room. And so today I have my M&M team. And so we have Michelle, give me that name, Grice, and Michelle Story. And they're going to tell you where they're from and what they're going to be doing for our class today. And then you'll get opportunity to meet the class.
Hi, I'm Michelle Grice. I am currently one of the TNCC faculty members that I live and work out of Kentucky. We are very grateful to be here. We have had such a warm welcome to be able to teach the Trauma Nurse Core Course, also known as TNCC. The Emergency Nurse Association is who developed the course, and we're able to give this nationwide and internationally to ER nurses. We're also able to bring in paramedics, medics, LPNs to help audit the course and to make it a team effort. We all know that trauma requires stabilization right away, and time is healing, time is heart, time is brain. So it's very important for us to be able to provide that.
Hello, I'm Michelle Story. I am also a TNCC instructor and a course coordinator working with Miss Michelle Grice. I feel very blessed as well to be able to come out to St. Croix and assist with this class. It's a great passion of mine to essentially help provide just trauma training to help strengthen their foundation and be able to have a standard approach to these patients to be sure that these patients are getting the quick stabilization that they need and then ongoing care that they need so that they can be hopefully have the best outcome possible.
I'm Ms. Jacqueline Greenidge Payne, and I serve as the Emergency Medical Services Program Director for the EMSC program throughout the territory. And we just met our nurses that's here from the Emergency Nursing Association. And before we introduce all of the beautiful nurses of this territory, that their healing hands have touched so many people in the territory. And I want to say thank you for the job that you do. Because working in the ER, I know it's a tough job. I've been there and I've done that. And many times people don't come back and say thank you. But we're saying thank you because we know the challenges and the difficult times that you have to work through to getting stuff done. So from us, on behalf of EMSC and our Emergency Nursing Association, we want to say a big thank you to you. And again, we want to give a big Virgin Islands welcome to the M&M team, Michelle and Michelle. And so we got bags from our Division of Tourism to say thank you and welcome to the Virgin Islands. And so the song I always say, come back to the Virgin Islands. Come on down. And so this is for you, Michelle.
Appreciate it. Thank you.
And this is for you, Michelle.
Thank you all for coming.
And thank you all. And we want you all to tell the people of the Virgin Islands what you're learning today.
Hi, I'm Lois Brown. I'm an ER nurse for the past 13 years, and today I'm participating in a traumatic nurse course, and it has been very informative thus far, and I'm glad to be here.
So which hospital are you working from?
I work at the Governor Wong F. Louis Hospital here on St. Croix, on the beautiful island of St. Croix.
Hello, good day. My name is Ashley Smith. I am an emergency room nurse from Schneider Regional Medical Center on St. Thomas. And we have been blessed with the opportunity to come to St. Croix to get our trauma certification and learning how to deal with traumatic experiences on our island and how we can work together and provide the best care.
No, Hillary, we can't leave you out. You all know this is Hillary's first time to St. Croix. Welcome, Hillary.
Thank you. My name is Hillary Norford. I also came from St. Thomas, working at Schneider Regional Medical Center with Ashley. I have been a nurse for about a year in the ER. It's very exciting. I'm happy to be here on St. Croix, the fabulous island of St. Croix. Better than St. Thomas, but we'll see. But so far, it's been a great experience. I'm happy doing the TNCC course. I'm learning a lot, and I'm just happy to be here.
Jenny.
I'm Jenny. I'm a nurse in the ER at Juan Louis, and it's nice to have a wonderful class with everyone you work with here. We're learning quite a bit today about each other also. Thank you.
Kadira McIntosh.
Hi, good afternoon. Like Miss Jackie said, I'm Kadira McIntosh, formerly known as Philip, if you know that's me. I've been a nurse for the past 6+ years. And of course, I work at the Governor Wong F. Louis Hospital Medical Center in St. Croix. And I'm learning the TNCC program, and it's been an amazing experience.
I don't know what I could say different, but I'm grateful to be here. I work at Juan Louis ER. Been there almost, 2 years. Yeah, that's it. En Spanish. Ay, Dios mío. Yo soy una enfermera en la emergencia de Juan Louis y estoy feliz de estar aquí hoy.
Good afternoon. I'm Natalie. I also work with these lovely ladies in the ER at Juan Louis. I'm just appreciative for the opportunity to take this course and learn all about trauma patients. Thank you.
And so we've been doing this. I have been the project or program director since 2018. But I started out on the Emergency Medical Services for Children grant as a family advisor network person. So having a granddaughter that's quadriplegic with special needs, my focus was taking care of kids throughout the territory with special needs. So I worked with Department of Education, gone through the school system back since 2010, making sure that the educators and the paraprofessionals and even the athletic lead, that they're trained in CPR and first aid so that they can be able to identify and take care of the children. And we go out and do many retreats with the Department of Education special need. They will do a family retreat weekend at DV, and we'll go out there and present many courses. But Emergency Medical Services for Children, we don't only make sure that the emergency room and the NICU is trained and have the right equipment, but we also make sure that we do that on the EMS side. So again, I want to tell everybody a big welcome and thank you. And as we move along with this grant, many more trainings will be coming. This has been the third TNCC program that we have put on in the territory since I've been the program director. So again, welcome to the Virgin Islands and enjoy your TNCC class.